Welcome back to Today with Dr. K. I'm Dr. K. Wise Whitehead. I'm joined now by Dr. Tanjala Purnell, an epidemiologist and health services researcher. She's an assistant professor of cardiovascular disease and clinical epidemiology at Johns Hopkins Bloomberg School of Public Health. Dr. Purnell, thank you so much for joining us.
Thank you so much for having me.
We are in the middle of our COVID vaccination hesitation conversation series. Where we stand now is we've been trying to bring our listeners as much information as possible about COVID-19. And now that we are at the vaccination stage, we want our listeners to be as prepared as possible to make an informed decision about where they stand with the vaccine. I want to begin by sharing some of the questions from our listeners who have either left us a comment or they have emailed their comment to Justina.Pollard, Pollard, at yahoo.com. These are all anonymous questions. So folks, you still have time to get your questions in for our next doctor. So the first question I want to put out to you is that people are concerned that this is not yet an approved FDA vaccination. Even Moderna or Pfizer, they all have this emergency approval, but they haven't gone through the final approval process. Can you talk a little bit about that?
So thank you. And also thank you for doing this. It is so important that we get trusted information into the hands and the ears of our listeners from trusted sources. And so, first, just a little bit about the emergency use authorization, which is what we know that both the Moderna and Pfizer vaccines used in terms of FDA approval. And so this is essentially something that would happen, for example, in the midst of a pandemic, when we really have a very serious or life-threatening disease or condition that really threatens our country. This is a process of approval that, has been used so that we can sort of get things into the hands of society in a more timely manner. But that's not to say that the process of developing these vaccines started and stopped in 2020. Actually, the process of using messenger RNA, which is sort of what was used to develop both of these vaccines. This is something that has been around for at least 10 years or longer. And scientists at the National Institutes of Health have perfected this method over a very long time. So while we don't necessarily, have 10 years of data saying that the actual process being used specifically for this novel coronavirus vaccine necessarily came, over decades of research. But the process of developing vaccines like this, we know that this is building off of decades of scientific research.
And I think that's something that scares people in thinking about it. There's now a battle ground that's taking place over the newest vaccines, right? So I'm thinking about Johnson & Johnson, which hasn't yet been received an approval, although Mayor Brandon Scott is looking to get them in Baltimore. I know America has ordered, I believe, 300 million doses of it. And I think about AstraZeneca, which, stopped their trials in South Africa. So it feels like you have all of these different types of vaccination. I know Moderna and Pfizer are the ones that people are most familiar with. Can you talk about the two new ones that are coming on the market?
Well, so with the Johnson & Johnson one, we know that as of right now, I believe in the trials with just one dose has been shown to be about 65% effective. And I know that there are some trials now that are also testing, both doses to see what will happen. And the same with, as you mentioned, the trial that was just stopped in South Africa. And so I think that just like when we think about other conditions, for example, diabetes, right? We have so many different types of medication. We know that each of these different types of medication work in slightly different ways, and they each had to go through a pre-approval process. They had to go through the trial phase to make sure that the benefits outweighed the risk and the harm, that there weren't going to be very severe and adverse reactions that will disproportionately outweigh the potential benefits of that particular treatment. And so that's the same thing that we're going through right now with our vaccines. And that's what you want to happen. Okay. You want us to have a process where we are vetting these different vaccines, just like we would vet any other treatment. We know that in these trials, most of the time, these are people who may or may not be representative of every single person who will later get access to it. But what you want is a diversity of people who are willing to sort of step up and participate in these trials so that we would then have more information to use, because what they are essentially reporting to us is sort of what happened on average among the people who participated in these trials. And so the more information that we get, from, one day you may hear that, oh, this seems to be going well, and now the trial was stopped, or this or that. That doesn't mean that the scientific process is failing. It actually means that it's working and that our checks and balances are working. With each of these trials and with each of our major scientific studies, we have what's called a data safety and monitoring board. And that means there are a group of scientists who understand what's going on in the background, understand what the potential risk and benefits should be. And if at any point they feel that the risks are outweighing the benefits, that's when you see something like this sort of happening, where you may stop a trial because they want to make sure that we are protecting even the people who are participating in those trials. So this is, just sort of how the process works. And that's what we want. We want transparency, and we want checks and balances to make sure that we are safe.
Now, one listener sent in a question. I think it's indicative of where a lot of people may stand with this, particularly out of the African American community. The listener writes, I have huge issues with medical distrust with the Tuskegee experiment and Henrietta Lacks. Yep. Why should I trust science now when we have been lied to before? And before I have to answer that, I just want to let people know, our listeners, that you are an African American woman. And so I think people have to understand that perspective is important. Where you stand does shape how you enter into this question.
Absolutely. And let me also, just preface this by saying that I in no way, and this is sort of how you earn the trust of the community, by always making sure that you let people know I'm not here on behalf of, my employer. I'm not here on behalf of any pharmaceutical company. I am here as an African American woman who decided to devote her entire career to rectifying the health disparities that disproportionately impact other African American communities. Part of this was driven by, what I saw in my own community growing up in the Mississippi Delta, which, if any of you, know anything about public health and mistrust and, health disparities and being lied to, you can know for certain that I understand what that means. And with that being said, what I will say, so a friend of mine, so I often speak with, like many of us do, we talk with our girlfriends about what's been happening in the news or just what was the latest information. And so a friend of mine, just, about a week or so ago, we were talking about this whole issue around Tuskegee and distrust and sort of what that means in terms of the COVID vaccine and the trials. So now that we've moved out of the trial phase and we really are in the phase of, vast dissemination of the vaccine, one thing that she pointed out that I thought was an excellent point was that if this was the exact same scenario, meaning, so we have to be reminded sometimes that what happened with the Tuskegee study was not that men were being injected with syphilis. What was happening was that once a treatment was discovered, that was withheld from them because, the scientists wanted to study the natural progression of the disease. Now, the equivalent to that today would be if the vaccines were being withheld from us after, first studying us to develop the vaccine. That would be the equivalent. Not saying that, you see people who, look like us and others being sort of on TVs and radios and saying, hey, I signed up, you need to go sign up, this is our best protection. If this really was the same, it would be the opposite. It would be everybody else getting access to the vaccine, and we're not. Another thing that an older family member of mine once pointed out was by saying, you don't need to, and I'm sure this is not appropriate for me to say, but I'm going to say it anyway. What she did was say, look at who's getting the vaccines. Look at who's lining up to get the vaccines. And that should tell you all you need to know about whether or not you need to be in line also trying to get the vaccine. So it'll be different if you didn't see anybody, wanting to sign up and go and get these vaccines and, and get them into the hands of their family members. That's not what we're seeing. What we're seeing is a mad dash in certain communities to go and get it. And then, other communities are being left behind. So pay attention to what that means. That means that in general, we should be making sure that we are also getting in line and making sure our family members and others are getting in line for this, because clearly there is a recognized benefit. And so I don't know if that helps, but those are some things to sort of keep in mind. The other thing, and that you can look up very easily, there was this really interesting news story about descendants of participants in a Tuskegee study who basically said, I understand the distrust. I understand more than most, and I still plan to get in line for this vaccine. And so, I encourage your listeners to go also and listen to their interviews and their reasons behind why they're saying, this is sort of our best chance and making sure that we are safe, especially when this virus, as we know, has hit our community much harder than most other communities. So does that help in any way?
I want to have you kind of break that down.
Okay.
Because we hear all the time, and I say it often on my show, it disproportionately impacts the African American community. We're 3 to 4 times more likely to go to the hospital, twice as likely to die. Black men get it more. I mean, Black women get it more, but Black men die from it more. And I've said it so much, people are like, you're lying to us. It just doesn't sound right. What does that really mean? So as an epidemiologist, can you talk about how there's truth behind what is being given to us, this information in particular?
Let me tell you. So I was doing an interview with a reporter a few months ago who said that his company had done a survey, and that among the participants, those who were self-identified as white were much less likely to say that they were very concerned about COVID, whereas those who were Black or African American were much more likely to say that they were concerned. And he said, I don't understand, the results of this survey. What could be explaining this? And I asked him, simple questions, in which, I challenged your listeners to do the same. How many of you know a person who has died personally from COVID? How many of you have had family members who have either been infected with COVID or severely ill, or, perhaps have died? How many of you have people that you know and love who may have died from other causes during this pandemic? That means you know how it feels to have to go and have a graveside funeral for someone that you love. You know how it feels perhaps to not even be able to travel and go home at all for those of us who live in other states. So what these numbers are essentially, the stories behind the numbers, because as you correctly alluded to, saying 3 to 4 times more likely, or people don't get that. But what it means is that people who look like us, who have many of the same day-to-day experiences that we have, are much more likely to end up contracting COVID-19, for getting severely sick if we contract it, and or possibly dying as well. And that means that there are many more funerals in our community. There are many more hospitalizations. And I'm sure many of you know that these COVID protocols within hospitals are not anything very warm and fuzzy. We've had family members during this pandemic, and we did not get a chance to say goodbye. That is not okay. These are not things that you just easily get over. And so what we're trying to tell you right now is that if we have any shot, any chance at avoiding this type of pain that could be inflicted upon ourselves, or that could be inflicted upon our family members, then we need to try and just do what is in our best interest to avoid that. It's not fun to know that you have a family member who's lying in a hospital dying and you cannot say goodbye. And it's not fun to not be able to have a proper farewell for family members who have lived on this earth, 80, 90 years, and that you cannot properly bury them. If this is our only shot at getting back at some level of normalcy, then we have an obligation to try and take that shot.
Another listener wrote, what's the point of me taking the COVID-19 vaccine if there's still a chance I might contract COVID-19 in the future?
Well, that's always the chance with anything, right? With any vaccine that we take. When we think about, all of the vaccines that we take our children for those wellness checks, with each of those, there's not a 100% chance that they won't contract polio and all of the different viruses. But what it means is that if enough of us get that vaccine, the likelihood of that happening diminishes greatly. And that's sort of the same thing that's going on with COVID. But then they're also reporting that even among those who may have contracted the virus after receiving both doses of the vaccine, there have been some reports that it may be a much milder version than you would have contracted had you not gotten the vaccine. So, we're still learning as much as we can, but what we do know, especially with the concept of herd immunity and other, sort of Epi 101 methods, is that, if we get enough of us vaccinated and, really taking the precautions that we need, then that's going to be our only chance of really, bringing down the risk of contracting this virus.
Now, a listener reached out to me with a concern, and their biggest concern is that they don't want to, end up 20 years from now and hear that commercial. If you were vaccinated for 20, you might be entitled to a settlement. Like that is, real.
That's real. That is real, and I'm trying to think of a diplomatic answer without sounding dismissive. I am a native Southerner, so we're kind of pretty direct. What I will just say off the top of my head is that I hope, and I'll tell you, I've gotten my first dose. I'm preparing to get my second dose in another week or so, and I'm still praying every night, just like all the rest of us, that all will be well. But what I have to say, about that, and this is the advice I would give my mom, my sister, those I love, is that I would rather take a chance and be here 20 years from now versus not being here 20 years from now because of shoulda, coulda, wouldas, So, what we know that with every other treatment, every other drug, every other vaccine, there will be new things that we learn down the road. But guess who will be learning those things down the road? The people who are still alive to learn those things down the road. And if what we're telling you is that people who look like you and I are much less likely to survive if we catch COVID, or much more likely to contract it now, then if what we're saying is that the vaccine for now is the best shot that we have of still being here 20 years later, then just personally, I think that is probably something that would help me with my own decision making about it.
Now, I'm a Southern girl too, from South Carolina.
All right, let's do it.
I'm telling you, there's a lot you just said in your eyes. I said,
and you stop and you pause because you're like, well, I don't know, living here in Maryland, even though Maryland is not like truly the North, but it's not, the deep South either. So, you always get told, well, don't say it that way. Go and say it another way. But I like to say it to people in the language that we speak, right? Sometimes I like to put all the PC stuff to the side. And as I mentioned, when I'm having these conversations with my family members, I throw all the PC out of the window, and we talk. So I hope that you'll give me a little bit of grace today and we can talk today.
Absolutely. Well, I often say on my show that there are conversations that I have that are for everybody.
Mm-hmm.
And then there are conversations where I'm talking to my people.
Yep.
And right now we're trying to save my community. When it talks about, because it's not just about the not taking of the vaccine, because the research shows that Black folks are saying, okay, we will take the vaccine. It's the wait and see around it. That's what I want to have you talk about, because the whole idea, well, let me wait a little while and see what happens. I'm not sure if you have time to do that.
You may not get, that may be your one call or your one chance to sign up. And I'm not saying that as a scare tactic. And I'll tell you, I don't go around preaching and telling other people what to do. That's just not my personality. I think we should all, use our best judgment and pray or meditate or whatever it is that helps us with our individual decision making. But what I can tell you is what I've seen with my own eyes, with some of my own family members, where, there have been, announcements saying you can now sign up, for the vaccines. And those who immediately went to sign up were able to get on a list and at least get that first dose and get a second dose scheduled. Whereas those who waited even 2 days were basically told you have to try again in 3 weeks, because we've already, given out all of the vaccines that we have to allocate right now. And in some states, what they are also saying is that if that particular area starts to run low on the supply of vaccines or start to run out, they may prioritize those who already have at least one dose before they offer, a new dose to someone who doesn't have any doses. So all of that, is reasons, why we need to try and, just really jump on it if we have a chance to try and get access to this vaccine.
A listener wanted to know, what is the difference between the two doses? And I thought that was a good question, given the fact that I've seen places and I've heard that they've canceled the second dose because they didn't get all the doses in. What's the difference between the two?
So that's a really great question. And that's something, a lot of people want to know about. I will let you know that in terms of the actual trials that were conducted and the studies and the reported 95% effectiveness or efficacy, et cetera, that was based on the two doses. And that's sort of what the recommendation is, that we need both of those doses. And some of the earlier studies that only used one dose, basically what they found was that after a few weeks, the immune reaction to it became much weaker over time, meaning that, we may not have the full protection if we only get one dose versus the two. There may be, some additional studies ongoing. I'm not aware, but what I do know is that the numbers that are being reported in terms of how effective these vaccines are based upon both of those doses, and that's the recommendation that scientists are giving, that people need both doses. And so I do hope that any areas that are not, giving out both doses will soon rectify that, because that is what the guidelines indicate to be most effective.
Now, one listener wrote in, and I think the question that the listener have is what many parents have right now. And so the listener wrote, I'm nervous about my child taking the vaccine. She is only 10 years old. What should I do? And expand that, because really what we're talking about is the under 16 crowd, right?
Exactly. Yeah, that's it. Exactly what I was going to say, that, unfortunately right now it's not even available for children that young. As you alluded to, the Pfizer vaccine has been approved for age 16 and older, whereas the Moderna one is still 18 and older. There are some new trials that are going on right now that is starting to enroll younger children. And we are, closely watching what's happening with those numbers. Again, making sure that the benefits outweigh the risk for all age groups. And so I believe the latest thing that I heard was from one of the experts at the CDC, indicating that, he hopes that this is something that may become available later in the calendar year versus earlier, because right now many of those trials are really just starting up for those children who are younger than the age of 16. So I think that as of right now, the best way for us to, still keep our children safe would be to follow many of those same guidelines that all of us, were following last year, and even should be continuing to follow now, right? Wearing our mask, washing our hands, keeping a safe distance, staying at home, doing things to protect ourselves are, as of right now, is still the best way to protect our babies.
I want to pull two questions together from two listeners, because I think they fall in kind of the same area. One listener wanted to know, if I have allergies, can I still take the vaccine? And another listener asked, well, I'm 3 months pregnant. How about me? So kind of two conditions, but I mean, I'm pregnancy, I'm just putting in that category.
Yeah, no, that's great. And I will say, in both cases, speak to, your own primary care providers. In every case, speak to the people that you trust to keep you alive, because that's exactly what I did. I spoke to my own doctors and made sure, even with my own, personal situation, is this the best for me? Got the green light and move forward. But I will say, in terms of allergies, I'm not aware of just, if you mean seasonal allergies, I'm not aware of any recommendations against getting it for just normal seasonal allergies. Now, if you have specific allergies to, anything that may be included within the vaccines themselves, then that may be different. And that's also, again, going to be a conversation that you should have with your primary care doctor, and or even if you sign up for the vaccine. I know that when I went, I had an information sheet that I, was basically explained to me, this is what it is. This is what, if you have X, Y, and Z, you may need to pause and stop. And they wanted to kind of confirmed to make sure that your doctors were approving of, like saying that it was okay for you to move ahead. So I think that those are the same precautions that I would give, to anyone, the advice. In terms of the pregnancy, as of right now, there have not been reports of adverse side effects for women who have received the vaccine while pregnant. I know that within the actual testing studies, some of the information that we know were in mice, pregnant mice. And as of right now, they have not reported any major adverse events for the mice that were pregnant or their offspring. But, obviously we know that that there could be very different scenarios for each individual human being. And so with everything, there is a calculated risk that we take. There is nothing that is guaranteed to be 100% safe for any of us. But as of right now, I am not aware of any just blanket recommendations that pregnant women should not be taking the vaccine.
Now, Dr. Purnell, I want to end by asking you a different type of question.
Okay.
And to get your feedback. So, and this is a personal question for me, and I've talked to other college moms who are going through the same thing. So my college son, all of his friends, in the midst of them partying somewhere in the back of my mind, they're like, "We'll take the vaccine, give it to us, we'll take it now." What questions should young people be asking? Because they want to take the vaccine just so they can get back out there. And I'm like, but then you should be taking some reflection time. So what questions should young people be thinking about when they're 20, 21, 22 or so before they just sign up and take it because they want to get back out to their lives?
That's a great question. So the first thing is that I would make sure that they have, at least gotten some type of annual exams or have, some type of history with a primary care provider or something. Even as young as early 20s, we may have underlying conditions and you may not even be aware. One of the first things that you will be asked, even if you get the vaccine, is about, do you have a certain list of conditions? And if you've never been to the doctor or haven't been in the last 5 years, you may not even be able to give like a true answer. You may not know. So that, I think would be the first thing. Am I healthy? How do I know that I'm healthy? Not just by, do I look visibly healthy, but have I, been to the doctor? Have I gotten just routine exams and things that are important anyway? The next question would be, which we know the answer is yes, but we could tell them to ask, does getting the vaccine mean that I can stop all of the other right? And we know the answer is no, you need to keep doing it, but we could tell them, ask them, because sometimes it's easier when they hear it from someone else, right? Other than mom. And so ask them, about things like, well, what are the types of activities that are, safe for me to still engage in, even after I've gotten both doses of the vaccine, right? So that could be one of those types of conversation starters that might be good. One thing that we know is that that people are recommending that, one dose alone is not sufficient. And meaning, even though sometimes those of us who may be a little bit more of a, I guess, risk taker may go, well, I got one dose, I can start, partying a little bit. No, not actually. They tell us in that window between the first and second dose, we need to still play it as safely as we did before we got the first dose, right? Because we don't have the full immunity. And so, maybe asking questions like, well, what are some things that I should look out for? Even after I've gotten that first dose, are there certain things that, I should be looking out for or aware of, or, things of that nature? Again, being young, we think that we are invincible. And while we know that there are some reported side effects, there could still be, some side effects that are in the higher risk category of adverse events that maybe younger adults may not be, thinking about. So for example, a high fever that lasts for a very long time that doesn't respond to pain medication, over X number of days. Maybe that's the time when you may need to call in and say, hey, am I okay, etc. So things like that. The other thing, and perhaps, you can think about, you can tell them I said this part, but maybe he should be asking, how can I help, in the midst of this pandemic? There's so many of our seniors who have expressed to us, at our church, we are, developing, like an educational seminar and all of that. And some of the questions that that the members have expressed were around scheduling, all of the barriers. If you are not very tech savvy, if you're not, connected to your phone 24/7, like many of us are, how can I help, some of the older adults in my community, in my church, in my neighborhood, or, those who are still very much struggling with trying to keep themselves safe and are scared, to go out and go shopping, are not, is able or capable of doing online shopping, all of those things. What role can I play to really make a difference? And I think, that could be one of those feel good questions and feel good moments. Also, just be thankful for the fact that we have a vaccine that is available to us, and how can we help others in our communities who may not have received it yet.
Well, thank you very much, Dr. Tanjala Purnell, epidemiologist and health services researcher and assistant professor of cardiovascular disease and clinical epidemiology at Johns Hopkins Bloomberg School of Public Health. Thank you so much for all of your time and for participating in our COVID vaccination hesitation conversation series.
Absolutely, my pleasure. And you all, please stay safe. We're all in this together. There are questions that we all have. You're asking the right questions. You're doing the right things, going to your trusted sources. The last piece is making sure we're doing all that we can to keep ourselves safe, but also to keep those around us whom we love safe as well. So stay well.